What is conductive hearing loss? The outer ear is the external parts of the ear. It conducts sound wave and direct them into the ear through the ear canal. The middle ear transmits the sounds from the outer ear to the inner ear. A conductive hearing loss happens when the ability to conduct sound from external and the middle ear into the inner ear is reduced or lost. And don't worry, conductive hearing loss are temporary and most can be cured. There are the causes of conductive hearing loss. First, fluid in your middle ear from colds or allergies. Number 2, ear infections or otitis media. Otitis is the term used to mean ear infections and media means middle. Number 3, poor eustachian tube functions. The eustachian tube connects your middle ear and your nose. Fluid in your middle ear can drain out through this tube, and fluid can stay in the middle ear if the tube does not work correctly. Number 4, a hole in the eardrums. Number 5, earwax or cerements stuck in your ear canal. Number 6, infections in the ear canal called external otitis, and you may hear this called swimmer's ear. Number 7, an object stuck in your outer ear. An example might be if the children put a foreign body in the ear when playing. Number 8, a problem with how the outer or middle ear is formed. Some people are born without an outer ear. And lastly, some may have deformed ear canal and have a problem with the bones in the middle ear. Conductive hearing loss classified as moderate hearing loss, which is it can hear most of vocal sounds and some of consonants. At this level, you are asking people to repeat themselves a lot during conversation in person. It may be difficult to hear and process.
Assalamualaikum and hi everyone. Today I'm going to show you technique how to measure hearing based on the specific hearing loss. Measurement of the hearing loss involves various techniques to identify specific aspects of the auditory function. There are 4 common methods that we can use to measure hearing loss. First one is pure tone audiometry. Second one is speech audiometry. And the third one is tympanometry. And the last one is auditory brainstem response. The first one is pure tone audiometry. Pure tone audiometry is a common hearing test that evaluates a person's ability to hear different frequency or tone. During the test, the individual will wear headphones and listen to a tone at various frequency and volume. The results are plotted on the audiogram, which help determine the type and degrees of hearing loss. This test is crucial in diagnosing and managing hearing impairment. The second one is speech audiometry. Speech audiometry assesses an individual's abilities to hear and understand speech. It involves the presentation of spoken words at varying volume and clarity. This test helps determine the person's speech reception threshold or an word recognition ability, providing valuable information about the functional aspect of their hearing. It is often used in conjunction with pure tone audiometry for a comprehensive evaluation of hearing capabilities. The third one is tympanometry. Tympanometry is a diagnostic test that measures the movement of the eardrum in response to change in the air pressure. It helps assess the middle ear function and can identify issues like a fluid in the ear, eardrum perforation, or problem with the eustachian tube. Tympanometry is a valuable tool in understanding the overall health and functionality of the middle ear, complementing other logical assessment. The last one is auditory brainstem response. Auditory brainstem response is a neurodiagnostic test that measures the electrical activity of the auditory nerve and brainstem in response to sound stimuli. Electrodes are placed in the scalp to record this response, providing information about the integrity of the auditory pathway. ABR is also often used to assess hearing in newborn, identify hearing disorder, and determine hearing disorder in individuals who may have difficulty with traditional behavior hearing tests.
Now I will explain the test for the test level of hearing loss. There are 2 tests, which is the ring test and the Weber test. So now we go to the ring test. What is the ring test? The hearing test differentiates sound transmission via air conduction from sound transmission via bone conduction. It can serve as a quick screen for conductive hearing loss. A hearing test should be done in conjunction with a Weber test to detect sensory neural hearing loss. Now we go to the material used. The materials that used in this hearing test is tuning fork. The tuning fork are useful in assessing hearing loss, and this test performed using 512 Hz tuning fork. So how to activate the tuning fork? The tuning fork can be activated by flicking it between your fingers or by tapping the tuning fork on the knee. So how to hold the tuning fork? When testing air conduction, the tines of the tuning fork should not be held parallel to the external audiometers. Instead, they should be held perpendicular to the external auditor meters and about 1 cm from it. So now we go to the steps. The first step is explain the test clearly to the patient. For example, so you are going to hear a buzzing. I want you to tell me which position it is louder. Second step is test position A, which is outer ear. This test for air conduction. For the third step is for position B, which is any bony area surrounding the ear. Bone conduction is tested by placing the base of the tuning fork on any bony area surrounding the ear. The fourth step is ask the patient which one is the louder. So now we go to the Weber test. The Weber test is a screening test for hearing performed with a tuning fork. It can detect unilateral conductive hearing loss and unilateral sensory neural hearing loss. For the materials, we use the same material, which is tuning fork, but the step was different. So the first one is explain the test clearly to the patient. Step 2, ask patient. For example, you can tell me whether you hear the sound loudest in your left ear and your right ear, or whether you can hear it in the middle. Step 3 is place on the base of the tuning fork in the middle line. The step 4 is ask the patient which one is the louder.
What type of device are suitable for mild to moderate hearing loss? There are 4 types of hearing aids are suitable for mild to moderate hearing loss, which is behind the ear BTE, in the canal ITC, completely in the canal CIC, and invisible in the canal IIC. So the first one is BTE, behind the ear, are device appropriate for people with wide range of hearing loss. This device fit nearly behind the ear. The body of the hearing aids are attached to the custom ear mold and thin tube. Because this device have several parts, manually discerted and necessary ensure proper insertion and placement. The second one is in the canal ITC. ITC hearing aids sit inside the ear canal, and they are popular choice for those looking for discrete means to improve their hearing. These hearing aids are popular choice among individuals who seek a balance between functionality and aesthetic. ITC hearing aids are customized to fit snugly with the wearer ear canal. This personalized fit not only ensure comfort but also help to reducing feedback or whistling sounds, providing a natural listener experience. The third and the last one is CIC and IIC. Completely in the canal CIC and invisible in the canal IIC hearing aids are the smaller of the hearing aids. Both CIC and IIC hearing aids are custom-made product designed specific for the wearer ear canals. IIC hearing aids are made to fit several millimeters in the back of the ear, while IIC hearing aids are smaller and designed to fit to the second band of the ear canal for a deeper and less visible fit. CIC hearing aids are slightly large and more visible than IIC hearing aids, although both styles are considerably smaller and less noticeable than traditional hearing aids.
Hey everyone, so now let me show you the plot audiogram that links to the patient. As you can see, for the right ear, the symbol will be marked circle or in red color. And for the left ear, the symbol is marked X or in blue color. At 1000 Hz, the patient hears at 55 decibel. At 500 Hz, the patient responds at 50 decibel, same as 250 Hz. From the audiogram, we can see that the range plotted is between 50 to 65 decibel. On this certain decibel and hertz, the patient is having a quite difficult to hear. For the final results, we know that the patient is having a moderate hearing loss for both right and left ear. You have learned some knowledge from our video, right? Let's go to the quiz session. We have some questions for you to answer. We will give you 30 seconds for each question to answer. Are you ready for the quiz? Let's start. You have learned some knowledge from our video, right? Let's go to the quiz session. We have some questions for you to answer. We will give you 30 seconds for each question to answer. Are you ready for the quiz? Let's start.